Hello everyone. Today I'll be discussing the contents of week 5 uh, and then following it up with some old assignment questions. In week 4 we looked at the biomechanics of spine, which was essentially a lot of vertebrae, the vertebral column, which consists of lot of vertebrae, which is demarcated here, and they are intercalated with intervertebral discs, which provide cushioning. Now the next, the bone set that's inferior to that is the hip bone set, which the major bone in the hip is pelvic bone, uh, and the uh, and this bone is joined to the femur, which is basically the thigh bone, um, using a ball and socket joint. The area where the hip joins the femur is called as acetabulum. That's basically the site in the hip that accommodates the femur's ball, and acetabulum forms the socket. While this just a sec- while this is similar to a ball and socket joint which you'd find in the shoulders, it's not it does not have that much freedom of movement, because there are a lot of ligaments here which essentially hold the bones in place, so that there is a stability to the person or to the human. Okay, so so uh, now we'll discuss the muscles that are present in the hip, which which uh, which are grouped into there are multiple groups that the muscles of the hip are majorly grouped into. The first group is the iliopsoas group, which, as the name suggests, uh, consists of the sorry consist of the psoas major, which form the psoas part of the name, and the iliacus muscle, which forms the ilio part of the name. The these muscles are responsible for flexion and lateral rotation. Lateral rotation meaning rotating to the side, and flexion meaning decreasing the angle between two body parts. Uh, the psoas major muscle originates from the lumbar vertebrae. So if you remember, the vertebral column is divided into cervical, thoracic, lumbar, and then you have the tailbone. Uh, so the lumbar bones is somewhere in, uh, if you anatomically place it, it will be somewhere near the stomach, the lumbar region. So the origin of the psoas major group is in the lumbar vertebrae, the first of the lumbar vertebrae, and the last of the thoracic vertebrae. It has multiple origins from there. The insertion is in the lesser trochanter of the femur. The greater trochanter is this. The lesser trochanter is somewhere here. So basically, even though it originates from the vertebral, it's a very big muscle. It originates from the vertebral column and goes on until the femur. Next is the iliacus muscle, which originates in the sacrum, which is below the lumbar vertebrae, again in the vertebral column, and then it inserts into the lesser trochanter of the femur. Both of these muscles are responsible for flexion and lateral rotation. Something to keep in mind. The next muscle group is the gluteal group, which basically consists of 4 different muscles: gluteus maximus, gluteus medius, gluteus minimus, and tensor fascia lati. The gluteus maximus, which you can see here in this area, is responsible for extension of the hip joint, and it originates in the dorsal ilium, sacrum and coccyx, so basically near the tailbone, and it inserts into the femur and the iliotibial tract. The iliotibial tract is basically near the shin. Then comes the gluteus medius muscle, which is responsible for abduction. Abduction, remember, taking away. Extension is increasing the angle. Flexion is decreasing the angle between two parts. Okay, just a recap. So the gluteus medius is responsible for the abduction of the hip joint. The origin is in the lateral surface of ilium, and again it inserts into the femur. Next is the gluteus minimus, which you can see is here. Now this is slightly it's not a very superficial muscle, it's a slightly deep muscle, and it is responsible for abduction again. It also originates from the ilium and inserts into the femur. Next is the tensor fascia latae, which is responsible for both flexion and abduction, so two functions. The origin again is in the ilium, in the iliac crest, and it inserts into the iliotibial tract, which is somewhere in the lower leg. So this was the gluteal group. Next are adductors, for which the major function is adduction, which is basically taking something towards the midline. It's the midline. Okay. This muscle group consists of three different muscles: adductor longus, adductor brevis, and adductor magnus. Now, as I said, these are adductors, so the major function the major movement that they'll control is adduction. The other movements, that the adductor longus muscle is, apart from adduction, is responsible for flexion as well. It's near the it originates near the pubis, and then it inserts into linea aspera. The adductor brevis again is responsible for adduction, as the name suggests, and flexion, similar to adductor longus. This also originates from the pubis, and it inserts into the linea aspera, but above the adductor longus, so above this muscle. So it's here, whereas the adductor longus is here, and below that is the adductor magnus, which, apart from adduction and flexion, it is also responsible for extension. And it originates from three different places, but again it inserts into linea aspera and the femur. Now there are certain muscles which might originate from here, but they insert into the knee joint or somewhere around knee joint, and they'll be discussed in the subsequent slides. Now that we discuss the muscles of the hip, coming to a numerical problem considering the hip. So the problem is that, consider a situation where a person is standing stationary, so a static problem, on the right leg, single stance. So basically you have a one leg problem, not a two leg. Figure A, which is here, shows the forces that are acting on the leg. Fm is the net force extended by the abductor muscle. Fj is the joint reaction force acting on the femur by the pelvis. W1 is the weight of the leg, and this is basically the center of mass. W is the ground reaction force acting on the foot, which is equal to the weight of the body. And theta is the angle that Fm forms with the horizontal. So this is essentially theta. Okay. So figure B is the mechanical model of the leg, which is here. O is the point of point along the instantaneous axis of rotation of the hip joint. Point A is where the hip abductor muscles are attached. So, and point B is the center of gravity of the leg, and point C is the ground reaction force applied. So basically Fj would act at O, and Fm will act at A. Okay. So the crux of the question is draw a free body diagram for the leg, determine the force exerted by the hip abductor muscles, and determine the joint reaction force at the hip. So basically this means we need to calculate Fm, and this means we need to calculate Fc. Okay. So the assumption is that this is the xy axis here. So what do we know here? We know A, which is the distance here between O and A. We know B, which is the distance between A and B, which basically, and we know C, which is the distance between A and C. We also know W. We know W1. We know theta, which is the angle that the force Fm forms with the horizontal. We know alpha, which is the angle that OA forms with horizontal. So this is alpha. And we know beta, which is the angle that OA forms with the vertical. Okay, which is basically this angle. Okay, and so these are the unknowns. These are the knowns: ABC, W1, W, theta, alpha, and beta. And we need to find Fm, Fj, and draw a free body diagram. So basically you need to draw all the forces that are there. If this is this is OA, this is AC, and this is AB, which forms B. The forces Fm, which is acting in this direction with theta, can be divided. Assumption is this is positive y, this is positive x. It can be split into Fmx and Fmy. So Fm is the arm that is connected to theta. So Fm is Fmx is Fm cos theta. Fmy is Fm sin theta. Both of these are in positive directions, but we'll come to that when we look at the actual equations. Next, we don't know what is the angle that Fj forms with the horizontal or with the vertical. So this is something that is unknown. But again, Fj can be split into Fjx and the y component Fjy. Okay. So Fjx is acting in this direction, Fjx is acting in this direction, and Fjy is in this direction. The first thing to do is write the moments equation and figure out what exactly is the dependence of Fm on the other parameters. Because Fj is acting at the origin or at O, there will be no moment because of that. The other components will have a moment uh, will have a moment term in the moment equation. So coming to all the will we have the table here, so I'll just use that. So there is fmx, which basically the distance between the origin and fmx is ay here, and since fmx is in this direction, it will turn this way, and therefore the direction is counterclockwise. Okay, fmy is from a distance of ax from the origin, and the direction is here, therefore it will move in the opposite direction, in the clockwise direction. w1, which is acting here basically at b, is at a distance of b. So if you see here, this will be this is ax, and this is bx. So w1 is at a distance of bx minus ax. Now, because now the moment arm for w1 is bx minus ax. w1 is in this direction, it will move this way because the origin is here, so it's also in clockwise direction. Now coming to w, which is acting here in this direction, the this is ax, this is cx, so the distance between the origin and this the moment arm is basically this portion, which is cx minus x. Coming to the direction, it's acting here, so it will move in this direction. Okay, now we'll write the equation. M is equal to 0. We'll consider this as positive, so this will be positive, this will be negative, negative, and positive. Basically fmx ay minus fmy ax minus w1 bx minus ax plus wcx minus ax, okay, is equal to 0. Okay, so and we know fmx is fm cos theta, fmy is fm sin theta. We substitute these two here. Fm cos theta, a cos alpha minus fm, okay, I'll use probably here, okay, I can see that. Fm sin theta to a, sorry, this will be a sin theta, sin alpha, sorry, this will be a sin alpha, a cos alpha minus w1 b cos beta minus a cos alpha plus w c cos beta minus a cos alpha is equal to 0. Then you can take all the terms that are common to one side, so fm into afm into cos theta sin alpha, so there is a term here, minus sin theta cos alpha Okay, plus W1 B cos beta minus A cos alpha plus W cos beta minus A cos alpha. Okay, and then you simplify this, you get W1B, you transfer all the terms on this side, W1 B cos beta minus A cos alpha into minus W into C cos beta A cos alpha by A times this particular term which is here. Now this term sin alpha minus beta is equal to cos sorry sin alpha minus beta is sin alpha cos beta minus cos alpha sin beta, and if there is a plus, there will be a plus sign in between. And so this is your Fm. Okay, now that you have Fm, you can compute the both the components of Fj, which is, if you can use Fm and you assume that this is the positive x, and so f in the x component there are only two forces here, Fjx and Fmx. Fjx, which is in the negative direction, and Fmx, which is in the positive direction, minus Fjx plus Fmx is equal to 0. So Fmx is equal to Fjx. So Fjx is essentially Fm cos theta. Now coming to the y component, summation of Fy is equal to 0, positive component here. In Fy there are four different forces: W, which is the reaction force, W1, which is because the weight of the body, and the y component of Fm and the y component of Fj. And you solve for this and you get Fjy to be this, and then you can compute the magnitude of Fj as Fjx square Fjy square. So imagine if this is Fj, and if you found Fjx and Fjy, this is basically the hypotenuse, and that's how you get this. And the angle would be the vertical by the horizontal. So tan inverse Fjy divided by Fjx. Okay. Now coming to the biomechanics of knee. So knee is the knee joint basically forms between the femur and the shin bones. Okay, it forms between these two here. We will look at the anatomy of the knee and the movements that are present in the knee. Coming to the anatomy of the knee, so this is tibia. The major knee joint that we consider, the main knee joint forms between the femur and the tibia, not the fibula. Okay, and there are again a lot of tendons and ligaments here to stabilize, because stabilize this particular joint, because there is a lot of weight that this joint has to face. It faces the weight from starting from the skull to the femur. So all of the weight, the muscles, the fat, everything is on this. So basically it needs to be able to move and it needs to be stable, both the things. Okay, and because of that, and there is one more bone, patella, which is the kneecap. This is also called as kneecap in common language, uh, which is which forms a covering on this particular joint, and uh, and there are a lot of muscles that a lot of tendons that stabilize this joint, particularly the cruciate ligaments, the posterior cruciate ligament and the anterior cruciate ligament, which can be uh, appreciated here and here. If this is the posterior side and the anterior side, these hold together the joint very well. And there are these medial meniscus. Medial means towards the middle, and towards the medial midline of the body. So if the midline is here, this is the medial side, and the lateral meniscus, which also help in stabilizing the joint. Okay, now coming to the move. So the knee joint is a hinge joint majorly. So it has 2 degrees of freedom. Sorry, it has 1 degrees of freedom. It can move 2 ways. Either it can flex, it can undergo flexion, or it can undergo extension. Flexion where you are decreasing the angle, and extension where you are increasing the angle. Okay. Now coming to the biomechanics of knee, as I said earlier, there are a lot of muscles that originate above the hip bone and enter in an area that's surrounding the knee, which and these are so basically these are very long muscles. And again, there are different groups of muscles here, and the first group is the quadriceps femoris group, which is in the anterior compartment of the thigh, and anterior meaning on the front. Okay, and this consists of 5 different muscles. The rectus femoris, and these can be responsible for extension, flexion, abduction, lateral rotation, etc. The first one is rectus femoris, which is responsible for knee extension and hip flexion. So opposing things, but at different places. It originates again in the iliac spine, and at the acetabulum, which is, if you remember, it is the insertion point of the femur. Basically the socket for the ball and socket joint that you will find at the hip joint. And it inserts into the patella and the tibial tuberosity, which is here. Patella and the tibial tuberosity. Tuberosity meaning here somewhere. Okay. Next muscle is the vastus lateralis, which is responsible for knee extension. It originates at the greater trochanter, which is in the femur, intertrochanteric line, again in femur, and linea aspera. It also inserts into patella and tibial tuberosity here. So this is vastus lateralis, and this big muscle is rectus femoris. Okay. Next, coming to vastus medialis, which is responsible for knee extension, which is here, this muscle. So as you can see, it originates somewhere here and inserts here. Again, it originates in linea aspera and intertrochanteric line somewhere in the femur, and it inserts into the patella and tibial tuberosity. So all of the muscles are inserting here. All of these 3 muscles. Next comes vastus intermedius. One more thing is that lateralis meaning on the meaning on this side, medialis meaning on this side, and intermediate is somewhere here. Vastus intermedius is responsible for knee extension, and it is also it also originates in the femur, but in the proximal femur, so towards the uh, hip bone, and it again inserts in the patella tibial tuberosity. Next is sartorius, which is responsible for different things: knee flexion, hip flexion, abduction, and lateral rotation. It originates in the iliac spine, so somewhere in the vertebral column, and it inserts into the medial aspect of proximal tibia, which is somewhere here. Okay. Next is the hamstring group, which consists of three different muscles: bicep femoris, semitendinous, and semimembranosus. Uh, the biceps femoris is responsible for knee flexion, hip extension, lateral rotation. It originates in the ischial tuberosity, linea aspera, and distal femur, femur. And it inserts into the head of fibula, lateral condyle of tibia. So two different origins, two insertion points. And you can see it here, this muscle. Okay. Next is the semitendinous muscle, which is responsible for knee flexion, hip extension, and medial rotation. It also originates in the ischial tuberosity, and it inserts into the upper tibial shaft. So this is the muscle that we are concerned about. Sorry, this is semimembranosus, which we'll be discussing next. This is the muscle that we are looking at. Next is semimembranosus, which is this one, which is responsible for knee flexion, hip extension, medial rotation. It also originates on ischial tuberosity. It inserts into tibia and the lateral condyle of femur. So two different insertion. Now that we looked at the biomechanics of the knee, we'll look at a few problems. Coming to a knee problem, in order to strengthen the quadriceps muscle, a person is doing lower leg flexion extension exercises from a sitting position while wearing a weight put. Figure A depicts the forces acting on the leg, whereas figure B, which is here, whereas figure B depicts the mechanical model of the leg with the necessary parameters to define the geometry of the problem. Here the various parameters are W1, which is the weight of the lower leg, W0, which is the weight of the boot, Fm, which is acting here, the force exerted by the quadriceps on the tibia through the patellar tendon, Fj, which is the joint reaction force of the tibiofemoral joint. O is the joint center, so basically the origin. A is the point on tibia where the patellar tendon is attached, so the point of action for Fm. B is the center of gravity for the lower leg, point of action of W1. C is the center of gravity for the weighing boot, point of action for W0. Now draw free body diagram of the leg and find Fm, Fj in terms of A, B, C, theta, beta, W1 and W0. A is the distance between O and A, basically the points for Fj and Fm. B is the distance between O and origin and the point of action of W1. C is the distance between origin and point of action of W0. Okay, so again slightly complicated, but if everything is taken care of, it's relatively simple. Okay, so we'll first use this to draw the, so Fm can be split into Fmy and Fmx, and this is the, if you assume this is the this is the positive y and positive x. Okay, Fj can be split into the y component fjx and x component fjy and fjx. Fjy is in negative y, fjx is in positive x, fmx is in negative x, and fmy is in positive y. Okay, and we'll come here. Theta is the angle that is formed by the line of action, and fm. Now this distance is ax, this distance is ay, this distance is by, and this distance is bx. Similarly, we can compute cx, which is this distance, origin, and cy, which is here. Okay. Let's see the moments that occur around the origin. Again, fj is acting at the origin, so there will be no moment because of fj. And so the moments will come from fm, both x and y components, and w1 and w0. So fm, coming to fmy, which is here, which is at a distance of ax from the origin. So the moment arm will be ax for fmy. Since fmy is acting on this direction, it will go this way. So in the counterclockwise direction. Next is fmx, which is here, which is at a distance of ay from the, this distance will be ay basically, from the origin. So the moment arm is ay for fmx, and the force is acting in this way. So therefore the direction of the moment arm will be like this. So it is in a counterclockwise direction. Next is w1, which is at a distance of bx here, and the direction, because w1 is acting this way, it will move in this way. So again, counterclockwise direction. w0 is, the moment arm is cx, and w1 will act like this. Okay, and normal trigonometry says that this, if this is beta, this will also be beta. Okay, and if this is theta, this will also be theta. So this will be beta. So the angle that fm forms with the x-axis is theta plus beta. Okay, so fm can be split into fm cos theta plus beta and fm sin theta plus beta. The x component is cos theta plus beta, and the y component comes from sin theta plus beta. Now ax will be, ax is at an angle of beta, is a cos beta, bx is a sin beta, ay is a sin beta, bx is b cos beta, because the angle that all of these form with the horizontal is the same, beta. Cx is c cos beta. Okay, and so assumption is that if we assume this is the positive x direction, so this will be positive, negative, negative, negative. Moments, summation of moments around O is 0. So fmy ax minus fmx ay minus w1 bx minus w0 cx. This is your equation. Sorry. This is your equation. Now we know fmx, fmy, we know ax, ay, bx, cx. So we can substitute all of this into this and then solve this particular equation. We find that fm is cos beta w1b plus w0c, a sin theta plus beta cos beta cos theta plus beta sin beta. Now this particular thing is nothing but sin theta plus beta minus beta. Beta cancel, so this thing results in sin theta. So fm finally becomes cos beta w1b plus w0c by a sin theta. Here, this. Now if you write the equation around fx with this as the positive x direction, in the x direction there are two components, fjx and fmx. fmx, so fmx is acting in this direction, so that it will have a negative sign. Fjx is acting in this direction, so it will have a positive sign. So fjx equates to fmx. Okay. Now fjx can be written as fm cos theta plus beta, because we computed here that fmx and fmy, fm is fm cos theta plus beta and fmy is fm sin theta plus beta. Okay. Now coming to fj, so you now know the x component. Okay. Coming to the fy, where this is the positive direction, is 0. Now fy has this, which is in negative direction, fjy. This, which is in positive direction, fmy. w1 and w0 both are acting in negative, so minus w1 minus w0. So fjy solves to fm y minus w1 minus w0. Now if fmy is fm sin theta plus beta, so your fjy becomes this. Then you can solve for fj's magnitude and the angle using these two parameters. Now coming to the biomechanics of the ankle, which essentially involves the anatomy of the ankle and the movements that occur in the ankle and in the foot. So the bones that would connect at the ankle would be the bones that are in the shin. So the ankle basically forms the joint between the foot and the shin, right? So the bones of the shin and the bones in the foot will converge here. This is the fibula, this is the tibia. This essentially is the ankle joint. This big thing, the major bone that you will find at the ankle joint is the talus, and there is the posterior bone is known as calcaneus. Similar to the palm, where there are carpals, metacarpals, phalanges. This does not have tarsals. This has metatarsals, which connect to the talus and calcaneus and phalanges. Okay. Again, ankle is one of the joints which holds a lot of weight. So a lot of wear and tear happens here, and a lot of injuries that happens while a person falls might happen at the ankle, because it bears a lot of weight. and basically it needs to be stable enough to hold on to the weight, and it also needs to be flexible enough to perform all the articulations that might be required for the foot, for the functioning of the foot. Um so when we talk about the ankle joint, this is what we are talking about, the subtalar joint, which uh, which essentially is responsible for inversion, eversion, supination, and pronation. All of these four uh, functions. Uh, and dorsi, dorsi and plantar flexion. So by dorsiflexion, it means when the foot is going towards the shin, the anterior portion, if this is the anterior and this is the posterior, the anterior portion of the shin, and plantar flexion involves turning the foot downwards such that it's going away from the anterior portion. Next is inversion. If this is the midline, inversion takes the foot towards the midline, whereas eversion takes the foot away from the midline, similar to adduction, abduction. Sorry. Okay. And some more functions. Some other functions that happen here are external axial rotation and internal axial rotation. Basically, rotation of the foot. If this is the foot, you can either rotate it this way or this way. Okay. Now, coming to the muscles of the ankle, which now there are several muscles in that insert into the ankle. However, their origin points will be either in the tibia, uh, will be might be in the upper tibia, so somewhere near the knee. uh, okay, coming to the first muscle that you'll find inserting into the ankle is tibialis anterior, which is here, this particular muscle. This is responsible for dorsiflexion and inversion, basically this and this. It originates at the lateral condyle and upper tibial shaft, so in the tibia and interosseous membrane. It inserts into the inferior surface of medial cuneiform in a place in the uh, ankle, and the first metatarsal bone. So basically it inserts here. For so this will be again one of the, let me clear this up. This is the first metatarsal. Like in the palm, this is the first, this is the second, this is the third, this is the fourth, and the little finger is the fifth metacarpal, is joined to the fifth metacarpal. In this case, the biggest the toe thumb is the first metatarsal, next is second, next is third, next is fourth, and the little toe forms the fifth one. So this particular tibialis anterior inserts into the first metatarsal, so near the thumb, near the big toe, not the thumb. Next is fibularis longus, which is here. Okay. It is responsible for plantar flexion and eversion. So plantar flexion and eversion, opposing movements, as tibialis anterior, which, and this is the fibularis longus. It originates into the upper portion of lateral fibula. So basically in a superior portion, somewhere here, and it inserts into the first metatarsal and medial cuneiform. So again in the big toe here. Next is gastrocnemius, which has which is responsible for foot plantar flexion and knee flexion. It originates at the medial and lateral condyles of the femur. So it's a very large muscle, and it inserts into the posterior calcaneus. So if you look here, this forms the calcaneus. Okay, this is the calcaneus. It's basically at the heel. It inserts here. It's next, and it can have a lateral head and a medial head. So a relatively large muscle. Next is the soleus muscle, which is responsible for plantar flexion, which is basically the turning the foot downwards. Okay, this originates in the superior tibia and fibula, so in the upper part of the just below the knee, and it inserts into the calcaneus again here. This is the soleus muscle, and this is the insertion point. Next is the plantaris, which is basically this one. It is responsible for foot plantar flexion and knee flexion, and it also originates in the femur, so a relatively large muscle, and inserts into the calcaneus and the calcaneus or the calcaneus tendon here. Next is the tibialis posterior. So the first one that you saw is here. The tibialis posterior is a relatively deep muscle, and you can see that it's this one. Okay, it is responsible for plantar flexion, and it originates in the superior tibia and fibula. Tibia and fibula. So basically in the upper, somewhere near the knee. It inserts into several tarsals and metatarsal. Okay. Now, so till now we have looked at ankle muscles, an ankle joint, hip muscles and hip joint, a problem of the hip joint, knee joint, and the muscles that are associated with the knee. Now coming to the ankle problem, we'll solve a problem concerning the ankle. The problem is that the figure on the right depicts forces acting on the foot when a person is standing on tiptoe using one foot and the other foot is off ground. Again a one leg problem. Okay, similar to the knee and the hip. The following are the parameters that are depicted in the figure. W is the ground reaction force, which is equal to the weight of the body. Let me just, this is W. Fm is the net force exerted by the soleus and gastrocnemius muscles through the Achilles tendon on the calcaneus bone. So this is Fm. Fj is the joint reaction force at the ankle applied by the tibia. This is Fj, and both of them are acting at different points. A is the point of attachment of the Achilles tendon to the calcaneus here. B is the ankle joint center here. C is the point at which the ground reaction force is acting on the foot. Assumptions: neglect the weight of the foot as it is small compared to the body. Relative positions of A, B, and C are known. Find Fm and Fj in terms of theta, beta, and W. We know theta, we know beta, and we know W. We need to find Fj and Fm. So, Fm, Fj, and W, all of them are passing through O, which essentially we can consider as the origin. Now, if we in some of the previous classes, we learned about the transmissibility of forces, wherein if the forces can be shifted along their line of action. So if Fm were to act here versus if Fm were to act here, or if Fm were to act here, it will have the same magnitude and the same direction. Same goes for Fj. It might act here, here, or here. And C, it might act here, here, and here. The magnitudes will remain the same. So the free body diagram, if this is the origin and these are the axes, let me just draw bigger. W1 is in W is in this direction. Fm is acting here at an angle of theta, and Fj is acting here at an angle of beta. So if Fj was acting here at an angle beta, you can, using parallel law, you can just shift the angle here. This is beta and this is Fj. So all of these are acting at one single point. So you cannot compute the moments here because everything is acting, your assumption is everything is acting at the origin. So summation of the moments, even though it's 0, it won't have any forces in it because there are no moments arm for these forces. So you have, and you can split Fm into Fmy and Fmx, Fj into Fjy and Fjx. So the two equations that you can compute is Fm, the summation of Fx is equal to 0 and the summation of Fy is equal to 0. Now coming to Fm, which is at an angle theta, so Fmx will be Fm cos theta and Fmy will be Fm sin theta. So Fmy will be here, Fmx will be here, or I can use this Fmy and Fmx. Fy is in this direction, it forms an angle beta with the horizontal. So Fjx can be split as Fj cos beta and Fjy is Fj sin beta. So the summation of I'll just write this out. So we saw that the summation of Fx, if this is the positive direction, is 0. Now in Fx there is Fmx acting in the Fmx acting around the x-axis but at this angle, so there will be a negative sign, plus Fjx, which is in this direction, is equal to 0. So Fjx is equal to Fmx in magnitude, and so Fjx we know is Fj cos beta, and Fm we know to be Fm sin Fm cos theta. So Fj essentially is Fm cos theta by cos beta. So we now have Fj in form of Fm. Now we will write the equation for Fy, which is also 0 because static problem, and this is the positive y direction. So in this there is Fm y component, which is Fm sin Fm y component. There is y, there is w along the positive y axis, and there is fjy along the negative, and there are no other forces involved. So Fmy we can substitute from here is Fm sin theta plus w minus Fjy is Fj sin beta is equal to 0. Now we know Fm minus Fj to be Fm cos theta by cos beta. So Fm cos theta by cos beta into sin beta. I'm just shifting w to the side. Now you take Fm sin theta minus cos theta by cos beta into sin beta plus w is equal to 0. Now w is equal to Fm cos, and I'll take the denominator in this, sin beta. So this becomes plus, this becomes plus, minus sin theta cos beta gets transferred here by cos beta. Now w is equal to Fm. So remember this term essentially becomes sin beta minus theta. So sin beta cos theta minus cos beta sin theta by cos beta. So Fm can be written as w into cos beta by sin beta minus theta. Cool. Okay, so now you have Fm. Then you can substitute Fj. So we had found that Fj is Fm cos theta by cos beta. So Fj will be Fm sin cos theta by cos beta. So Fm into, so you substitute Fm w cos beta by sin beta minus theta into cos theta by cos beta. You cancel out this, becomes w cos theta by sin beta minus theta. So Fj is this, so Fm becomes this and Fj becomes this. Okay. So we looked at 3 different problems, one concerning the ankle, one concerning the knee, and another one concerning the thigh, concerning the hip bone. So remember, there are a lot of muscles which are essentially coming out of the muscles that are inserting in a joint might not essentially origin at a place somewhere near the joint, because which because there are a lot of muscles that originate from the femur but they enter into the tibia. They insert into the tibia. Similarly, for the foot, there are a lot of muscles that originate in the tibia, but they are finally enter in the superior tibia, but they are finally entering into the foot. So, I will discuss a few problems. Let me just share the screen. Okay. 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 So I'll discuss a few questions that were um that concern this particular uh, week. These are some of the old assignment questions. The first one is that match the different types of joints with their corresponding example. Modified hinge joint, pivot joint, ball and socket joint, and hinge joint. So, hinge joint is knee joint. Ball and socket joint is a hip joint, and a pivot joint is an atlantoaxial joint, which is here in the neck. And modified hinge joint is the atlanto-occipital joint, which basically holds the skull in position. So the answer is 1A. Pivot joint is atlantoaxial joint, ball and socket joint is hip joint, this is a hinge joint, knee joint is a hinge joint. What is the primary function of intervertebral discs in the spine? To allow for rotational movement between the adjacent vertebrae, to provide sensory feedback to the central nervous system, to serve as attachment points for the ligaments and tendons, to fill the gap between the adjacent vertebral bodies and provide padding during weight bearing. The answer is to fill the gap between the adjacent vertebral bodies to provide the padding during weight bearing. These are basically, these form discs and they stabilize the system and they prevent adjacent vertebrae from grinding against each other as well. What is the primary function of sternocleidomastoid muscle when contracting unilaterally? Head flexion to the same side, head flexion to the opposite side, head rotation to the opposite side, or head rotation to the same side? The answer is head rotation to the opposite side. Unilaterally implies one side. So if it's contracting on the left side, it is helping in the movement of the if it's contracting on the left, it will help in the movement of rotation of the head towards the right side. For example, which of the following movements are observed in the spine? So, this is a multi-choice answer. Internal rotation, lateral flexion, hyperextension, and abduction. The answer is lateral flexion and hyperextension. The head of the femur articulates with the dash in the pelvic bone. Greater trochanter, acetabulum, ischium, or sacrum. Ischium, sacrum belong to the spinal column. And greater trochanter is in the femur of the body. So the answer is acetabulum, which basically forms the socket for the head of the femur. Which of the following movements are observed at the hip joint? Internal rotation, lateral flexion, hyperextension, and abduction. Remember, hip joint is a joint between the acetabulum and the ball of the femur. Okay, there can be multiple movements. Except for lateral flexion, internal rotation, hyperextension, and abduction, all of these happen at the hip joint. Dash is the largest joint in the human body. Knee joint, hip joint, shoulder joint, atlantoaxial joint. Answer is knee joint. Which of the following is not part of the knee joint? Anterior cruciate ligament, lateral meniscus, patella, acetabulum. Anterior cruciate ligament holds the tibia to the femur. Lateral meniscus is also responsible for stabilizing that portion. Patella is basically the kneecap. So the answer is acetabulum, which forms the socket for the hip joint. Which of the following movements at the ankle following are the movements of occurring at the ankle? Dorsiflexion, extension, internal rotation, eversion. And the answer is dorsiflexion and eversion. Extension and internal rotation do not occur at the ankle. Gastrocnemius muscle is responsible for the following events: plantar flexion, inversion, dorsiflexion, and knee flexion. Plantar flexion and knee flexion. It's a long muscle. Okay. If there, I'm assuming there are no more questions. If there are any doubts, please feel free to ask me. To summarize, we saw that the biomechanics of the hip, which involves the hip joint and the muscles of the hip joint, which includes the iliopsoas group, the gluteal group, the adductors. Next, we saw a problem involving the hip joint. Before that, this is the greater trochanter, where there are a lot of insertions, lot of origins. And we also looked at a numerical problem involving the hip joint. We looked at the biomechanics of the knee, which is the articulation between the femur, patellar bone, and tibia and mostly tibia. The fibula is present there, but a lot of articulations occur between these three bones. And we looked at the anatomy of the knee, the movements of the knee, all of the muscles and the joints that are present in the lower limb, basically the leg, have stronger ligaments, essentially because they need to hold on to the weight of the skull, the torso, and the knee joint has to hold on to the weight of the hip and the thighs. The ankle has to hold on to the weight of everything that is superior to that. So all of these and a lot of injuries occur uh, when the weight is more. A lot of injuries might occur, or with age, because the tendons and ligaments starts to degrade. There is a lot of injury that might happen in these areas. We looked at the biomechanics of the knee, basically the muscles of the hip and knee, because there are a lot of muscles that are common between the hip and knee. We looked at the quadriceps femoris group, the hamstring group, and we looked at a numerical problem involving the knee. we looked at the biomechanics of the ankle, and which involves the anatomy of the ankle, the movements of the foot, and the muscles of the ankle. There are six major muscles. Um, we looked at the and problem involving the ankle. So the thing, so here we use transmissibility principle, or the principle of transmissibility. Okay. uh, and that's it. um, since there don't seem to be any questions, thank you for listening. I will end the call then.